So as far as your spine goes, there's 33 vertebrae. Those are irregular bones, and they're just overlapped, stacked on top of each other, and that is what actually protects your spinal cord. Okay, spinal cord is essential for movement, so it does help with flexibility and movement, so you can rotate, go side to side. And what really helps with that is going to be the cartilage in between the vertebrae, the cushion part in between. Then we have 12 ribs on each side, so it's 24 in total. And then your sternum. And see, Rodolfo, what did we say is the job of the sternum? What does it do?
Protects the heart and lungs.
Heart. The ribs protect the lungs. Protects heart, that's the sternum job. Lungs, that's gonna be the ribs. And also protects your major blood vessels. So the major blood vessels are going to be, I'll write them down for you right now. The major blood vessels that we're talking about are going to be your aorta. And then you have your inferior vena cava. And you have your superior vena cava. So we'll say this is your heart. Your aorta kind of comes up from the top of the heart, and it's coming from the left ventricle, but it's still traveling to the inside, and it's going to exit the top part. Your superior vena cava brings blood to the right side of your heart after it's been used. It brings it from the head and arms, so from the upper, superior part of the body. Superior means towards the top. The inferior vena cava is going to bring blood from the lower part of the body, from your legs, your stomach, the lower extremities and stomach, pretty much. Okay? So there's your little drawing, your reference points, where the blood is coming from. This blood has been used up. This blood is fresh with oxygen. And we still have to go over that chapter itself. Just a little anatomy in there. Any questions about this one? Where's Jeremy when you need him? Ask questions. Let's see. Joshua, I'm about to do CPR on a baby, on an infant. What is something I want to consider before I do airway management, before I ventilate that patient? What am I going to consider?
Like a choking hazard, or the reason a baby might need CPR is because they're not getting air.
Let me rephrase it. So before I do my head, tilt, chin lift, what do I want to consider when it comes to the head, tilt, chin lift? What do I want to prevent?
Not going too far.
Not overdoing it, right, with the head, tilt, chin lift. Matthew, why? Why does that matter?
Because their bone and cartilage are fragile, so if you go too far back, you kink the...
Because it's flexible, right? It's super flexible. Okay. And Edward, how fast do I want to give every single ventilation when I ventilate a patient, any patient?
1 second.
1 second each. Jerry, why do I not want to give a forceful ventilation? Too much, too fast?
To an infant?
To anybody. Say with the BVM, at anybody.
Oh, because then you'd over pump, and it could cause a gastro.
The gastric distension or inflation, right?
Yeah.
Good. All right, so here's your visual. So the spine itself is broken down into these 5 sections. Here's the sacrum and the coccyx. Those are fused. Those vertebrae are fused. Cervical is going to be the neck area. We have 7. The first one and second one are called atlas and axis. Those are the ones that actually allow us to rotate our head like this, the way they're designed. And I'll show a video after this slide as far as like how they're designed and why they function the way they function. So thoracic is going to be the chest cavity. That's thoracic. That's that region. Lumbar, I'm pretty sure you guys have seen infomercials for lumbar support. That's the lower back. Just tie that in somehow, okay? Lumbar support, lower back. Then you have your sacrum and your coccyx. Coccyx, think of Napoleon Dynamite. That's the first time I ever heard that.
You guys are probably too young for that. And again, Alex, what is the main function, the main job of the spine?
To protect, the, what is it called, nervous system? The
Spinal cord.
spinal
Okay,
cord.
okay, what you're saying, spinal cord. Goes right through here. And then, Alexis, the spinal cord is what part of the nervous system? There's two subcategories. There's a nervous system and there's two subcategories. Anybody want to help her out? CNS, central nervous system, yeah. So it's part of the central nervous system and the peripheral nervous system. The central nervous system is the spine and the brain. Easiest way to remember that, central is in the center. And then your peripheral is anything that extends out from the spine. Peripheral, because you guys don't know, peripheral means towards the outside, away, peripheral, on the outside, on the exterior. That's peripheral. We didn't go over this, but I'm gonna ask who knows approximately how much blood is pumped with every contraction from your left ventricle?
Figure.
Hmm?
Figure.
Nah, it's way too much. How do you call? Oh, that's a big ass heart. Maybe a horse. Maybe, I doubt it. So approximately 70 ml. Yeah, and it'll come up in the cardiac chapter, but just so you guys know. So that's how much blood is pumped out with every contraction. We're not gonna. I don't think that when we're doing CPR we can actually pump out that much, but you know, it's better than nothing.
You said 7 or 70?
70 ml. 70. Dylan, when it comes to the conduction system of the heart, where is the heartbeat generated? Where does that impulse come from that starts the heartbeat?
Does it come from the apex?
No.
It comes from the ventricles?
No. Anybody?
SA node?
The SA node. Where is the SA node located?
Top right.
Top right atrium? Who remembers specifically where on the atrium it's located? Front or back?
It's front. The front.
Back, posterior, in the back. Okay? That's more of an advanced question, but the more you know, the better you're gonna be. Okay? Alright, let's keep going. Alright, so your pelvis, this is where it's broken down in.